Moving on to general medical terms. So these are not word roots. These are not prefixes. These are not suffixes. Even though some of these terms may have word roots, prefixes, and suffixes attached, we're looking at like an entire definition of a term and what those definitions actually mean. Okay, so let's jump into that. Okay, so first up, we have ABC. Easy as 1, 2, 3. For the most part. So ABC references things that we need to check before we begin efforts to resuscitate somebody that might need medical attention, like immediate medical attention. Those three things, ABC: airway, breathing, circulation. So it's kind of a little out of order. You need to check to see if they're breathing, of course. If they're not breathing, you need to check the airway to see if there's a blockage in the airway. And you need to check their circulation to see if their heart is even beating. If it's not, you got to start cardiopulmonary resuscitation immediately. Do those chest compressions. Get the blood flowing as quickly as possible. I've done CPR before. Kind of a weird situation to be in. Trying to do CPR for somebody, but you got to do what you got to do. He was still breathing, but really, really shallow breaths. So you do the CPR to make sure that the blood is pumping and you're getting as much oxygen into that blood as possible. Anyway, ABC, the things that you check before administering resuscitation efforts. Okay. Moving on, abscess. So an abscess is a localized collection of pus. So it's pus that's in one area. Usually it's not just a small amount, it could be a decent amount of pus in that area. A lot of times it's underneath the skin, directly underneath the skin. So draining the abscess, lancing it and draining it and cleaning out the area typically helps quite a bit with abscesses. One of my old cats, he used to go out and get into fights with other neighborhood cats, and he'd have bites on his neck, and then just randomly he'd have an abscess in those areas. Weird, huh? And nobody would know until the abscess showed up, so I would drain that. So I have some experience with abscesses. Pretty gross. Anyway, moving on. Acute, not me, of course, not me. Acute, referring to conditions. An acute disease or condition has a sudden severe onset, something that occurs quickly that is kind of intense, and it, depending on what it is, can be life-threatening, or it might just cause pain in that one instance. So I was out shoveling snow a few days ago, and I had an acute injury in my lower back that I am still feeling to this day. So that's an acute injury. It's not something that constantly happens. Just happened that one time. Pretty severe pain for the past couple of days in my lower back. I'm dealing with it anyway. So acute, sudden, severe onset of a condition or disease. Adhesion. So adhesives. We think about tape. We think about glue. We think about scar tissue. And adhesion is something that's stuck together, right? So scar tissue is going to stick two things together, like if you get a cut in the skin. I have a nice scar here on my lip. I fell face first onto glass when I was 3 years old. I remember it vividly, but you can't see it with my facial hair. If I didn't have my facial hair, you'd definitely be able to see it. But the scar tissue that formed after they sutured it up, that's an adhesion, sticking the two sides of my lip back together. The doctors did a great job. You wouldn't even know it. Really. I mean, like I said, you can see it, but my lip was pretty mangled. They did a pretty good job of fixing that. Okay, moving on. So adhesions, process of being stuck together. They stick things together. Okay, ambulant or ambulatory. Now, I just kind of mentioned this in the suffixes, right? Ambulatory means the ability to walk. Okay, so if somebody is ambulant, they have the ability to walk. If they are ambulatory, they are able to walk. Okay, just think about ambulance. We use an ambulance if somebody is unable to walk to a hospital or an emergency room or something like that. Okay, moving on, arrest. So an arrest, like a cardiac arrest, is cessation of a bodily activity or function. So with cardiac arrest specifically, it's the heart has stopped beating, right? Not a good thing. You want your heart beating, right? The heart should be beating, ideally, in most cases. So cardiac arrest, the heart just stops with flatline on an EKG. Not a good thing. So arrest, just stops working. Okay, aseptic. So septic, if something is septic, that means it is dirty. There is bacteria. It is toxic. It is poisonous in some way, right? If something is aseptic, that means it's sterile. So when you go for and get a surgery done, you want a completely aseptic environment. You don't want it to be dirty. You want it to be as clean as possible. You don't want a bunch of microorganisms floating around all the place and all over the place and possibly getting you sick when you get opened up. Right? Not a good thing. So you want an aseptic environment, and your massage room should be as aseptic as possible. You know, you can only do so much, of course, but try to make it as clean as you possibly can. Okay, so aseptic without sepsis. Okay, autonomy. I think we talked about this a little bit earlier, right? So auto means self. So autonomy is being self-governed. It's making decisions for yourself in your best interest, right? You figuring out what's best for you. You having the autonomy to decide for yourself what's best for you. Okay. Moving on, benign. So a benign tumor is a tumor that does not spread. Okay, so something like a lipoma is a benign growth. A mole is typically a benign growth. When it starts to spread, that's when it becomes malignant. But skin lesions on your body, like moles, like freckles, those are typically benign. They do not spread. They do not affect other parts of the body. Okay, so benign does not spread. Biopsy. Okay, so a biopsy is surgically removing tissue to examine that tissue microscopically. Now I'm gonna, like I kind of said in a previous video, I have had a biopsy performed on part of my skin that you can't see. It's right in here in my elbow. It was just scar tissue, and I told the dermatologist, I'm pretty sure it's just scar tissue, but did a biopsy just to check, just to make sure it wasn't anything else. So he confirmed that it was just scar tissue. Thanks for slicing off a layer of my skin just to tell me it was scar tissue. Anyway, so biopsies can be done by actually cutting off a piece of tissue or inserting a needle into a tumor and then extracting cells that way. So a couple different methods for biopsies and figuring out, what this growth is, what this tissue is, just to make sure it's not something dangerous like cancer. Okay, moving on, cachexia. So cachexia is loss of appetite and just general malaise that you might see in somebody who has advanced stages of certain diseases like cancer, where they might experience weight loss. They might just not want to move. They might just be generally just tired all the time. Just one of those things, in late stages of a person's life, when we're going through the dying process, we can develop cachexia that kind of thins us out, right? And just doesn't give us any energy. So cachexia, usually associated with something like cancer. Okay. Moving on, carcinogen. So cigarette smoke, all the chemicals in cigarette smoke, carcinogens, asbestos. There are a lot of carcinogens out there, right? You expose yourself to things that shouldn't be in the body or on the body for an extended period of time, and it can alter the DNA of your body and cause cancer, right? So those are carcinogens. That's it. Carcino means cancer. Gen means produce. So it's a thing that produces cancer, something that produces cancer. Moving on, chronic. So a chronic condition, as opposed to an acute condition, is a condition that lasts for a longer period of time and is typically recurring. So my asthma is considered a chronic condition. I've had it my entire life, and I'm not always wheezing. My lungs aren't always tight, and it doesn't always feel like there's somebody sitting on my chest, but once in a while it happens, right? So that's considered a chronic condition. Hepatitis C is considered a chronic condition where the virus will attack the liver and then it will kind of subside, and then maybe a few months later it'll attack the liver again and then subside and then goes back and attacks the liver. So that's a chronic condition, something that keeps happening over and over and over again. Okay, so it's a disease or condition that persists over a period of time. Chronic conditions can be serious, of course. Acute conditions can be much more severe because the body isn't used to the conditions that the disease or condition is putting the body into. Okay, so all kind of depends on the disease, of course. Moving on, callus. Callus means neck. We mainly just see this with torticollis, the twisting of the head and the neck, right? Due to the tightening of the sternocleidomastoid muscle that pulls the head and the neck into this position. So maybe your head is just tilted a bit to the side. But you get used to it. Imagine the way your brain perceives the information coming into it kind of adjusts for that, so it doesn't feel like your head is off to the side like this. Some people have tight muscles in the neck and their head might be just tilted to the side just a little. But they don't notice it because their brain tells them, everything's level, processes that information just a little bit differently. Anyway, callus means neck. Make sure you know that one. Torticollis, twisted neck. Okay, diagnosis. Something we don't do as massage therapists, of course. We don't diagnose. But we got to know what a diagnosis is. You got to know what it is so that you don't do it, right? So a diagnosis is a determination of the cause of a disease. It's saying you have this disease. Here's why you have this disease. Okay, something we don't do as massage therapists, and we can say you might have this, but I don't know. I'm not a doctor. You need to go see a doctor to get a proper diagnosis. Never diagnose a client. We're not doctors. We don't do that, right? You can say it could be this, could be this, could be this. I'm not sure. I'm not a doctor. You got to tell them you're not a doctor. You need to go see a doctor to get a diagnosis. Okay, so diagnosis is saying basically you have this disease. This is the disease you have. Okay, edema. We kind of went over that just a little bit ago, right? Swelling is edema. So edema is an accumulation of fluid in an area. Very specific fluid though, interstitial fluid, water, lymph, as opposed to blood. So blood, an accumulation of blood in an area is inflammation, and accumulation of other fluids like lymph or water or interstitial fluid in an area is edema. Okay. Etiology has something to do with disease. So the etiology is basically saying what the cause of a disease is. So pathology would be, this is the disease. Here's a disease. This is a disease. The etiology is kind of under that in here's what causes the disease to occur. So you have pathology, then etiology saying this is why the disease happens. So lung cancer, the etiology could be cigarette smoke, right? So there are so many examples. Like influenza, you have fever, right? Viral infection is the etiology of that fever if you have influenza. Anyway, moving on. Excision, to excise something from the body. You are doing what to it? Excise something. You are surgically removing it from the body, right? So if you were to excise the tonsils, you are taking them out of the body. Excise the gallbladder. You are removing it from the body. You are surgically taking it out of the body. Okay, so an excision is removing something from the body surgically.